Raquel colon cancer symptoms. Raquel, a 33-year-old woman living in the Seattle area, was diagnosed with stage 4 colorectal cancer in 2023 after experiencing concerning symptoms for several years. Before we go on with this sad story, what is colon cancer? Alright. Colon cancer is a type of cancer that begins in the large intestine or colon. It typically starts as small, non-cancerous clumps of cells called polyps that form on the inner lining of the colon. Over time, some of these polyps can become colon cancers. Colon cancer is the third most common cancer diagnosed in the United States, affecting men and women equally. It usually affects older adults, though it can occur at any age. If detected early, colon cancer is highly treatable, but it can be life-threatening if allowed to grow and spread. Having that said, in 2019, Raquel started noticing changes in her bowel movements, including frequent trips to the bathroom, pencil-thin stools, pain, bloating, and mild blood in her stool. She also began feeling full quickly after eating. Initially, Raquel attributed these symptoms to her diet, thinking she might have a food intolerance or wasn't getting enough fiber. She tried making dietary changes and taking fiber supplements, which provided some relief, but the symptoms would return. In 2022, while working as a contractor in the tech industry, Raquel's symptoms worsened, and a coworker noticed how often she was using the bathroom. Raquel recalls, she said, "Raquel, are you okay?" And I said, "Yeah, I feel like I'm fine. I feel like maybe it's the dairy, my coffee, maybe I have a gluten sensitivity." Despite her concerns, Raquel dismissed her symptoms, thinking they were not serious. When she finally went to the doctor, she was told her issues were likely due to anxiety. It wasn't until Raquel's symptoms became severe, and she ended up in the emergency room, that she was diagnosed with stage 4 colorectal cancer. The cancer had already spread to her liver, ovaries, and lungs. Raquel has been sharing her story on social media platforms like TikTok and Instagram to raise awareness about the importance of listening to your body and seeking medical attention, especially for young people. She emphasizes, "I learned that colorectal cancer is very slow-growing. I could have had cancer for 8 to 10 years, potentially all of my 20s, without knowing it." After her diagnosis, Raquel began chemotherapy treatment, which included a combination of oxaliplatin, 5-fluorouracil, or 5-FU, and irinotecan. The cancer had caused a buildup of fluids in her stomach, leading to bloating that required drainage. Raquel's doctors advised her to modify her diet, limiting meat intake, avoiding raw fruits and vegetables, and sticking to soft foods like pudding and mashed potatoes, which helped improve her bowel movements. Despite the challenges, Raquel remains determined to beat the odds. She continues to undergo chemotherapy every 2 weeks, though she has switched to a different drug due to unpleasant side effects and lack of response to the initial treatment. Raquel is also exploring surgical options and looking into new treatments and clinical trials. In sharing her story, Raquel hopes to inspire others going through similar experiences. She reflects, "I feel so confident that whether I can heal from this or not, I'm going to be able to handle it well. It'll be okay. I've overcome other things in life, and I hope that I can be an inspiration to people who are struggling."